Hello guys, hope you're all doing well. I'm so excited because you guys are amazing. Thank you for subscribing to my channel. Thank you for being here. If you've been referred here by a friend or a family member of mine, I want to say a very big thank you for subscribing to my channel. Today's vlog is about World Mental Health Day. Because today marks the 10th of October, making it World Mental Health Day, and my organization Champions for Life has partnered with other different organizations around the country to talk about mental awareness and mental health. My organization's main goal is to empower young girls and young women who are vibrant, self-reliant, to help them, and those who are economically stable, to help them facilitate designing and developing of girls and young women, mentorship and social entrepreneur interventions to address the socio-economic needs of vulnerable girls and young women. So basically, Champions for Life has partnered with other different organizations in Kenya to talk about World Mental Health Day. We conducted a tweet chat with focus of this year theme mental health for all, great investment, great access, everyone everywhere. That was the main theme. I have 7 questions here with me. I'm going to read them out. 7 questions that were tweeted today, and I'm also going to share the responses that was given. I hope you're going to enjoy this video. Give this video a thumbs up if you like it. Comment on what you think about Kenya Youth Men. So I'm going to read out the questions that we had, the 7 questions, and I'm also going to read out the responses that we brought out. So guys, you can also comment down below. The first question that was asked is, what are the main challenges faced in mental health programming? What are the main challenges faced in mental health programming? And Arthur Onyango from AYMH Coalition responded by saying lack of political will, lack of community support, and inadequate mental health investment in public and private sector. That was his response. And also a tweet from let me see, Joseph Ojuki. I've read his response. No. Also a tweet from Joseph Ojuki. He said poor system compatibility. The English. Poor system compatibility, lack of IT support, inadequate training, and high hardware and software cost. Back to the question. The question was, what are the main challenges faced in mental health programming? What are the main challenges faced in mental health programming? Those are the few answers that were said. Question number 2 is, why are youths most vulnerable to mental health condition, and how can we reduce the prevalence? Why are youth most vulnerable to mental health conditions, and how can we reduce the prevalence? Guys, comment down below. Tell me what you think about that. Rural to Global Organization said at the adolescent age, young people undergo so many physical, emotional, and physical changes, most of which they themselves don't understand. They need close guidance and mentorship as they traverse the stage. I think that's true. I think that a lot of adolescent teens undergo so many physical change that don't know, or rather don't even understand what's going on. Personally, I'd say my small brother is a teen, and he's actually right now undergoing a lot of changes in his body, undergoing a lot of things. So you need someone to talk to, you need someone to tell you this is what is going on, you know, other than not being aware, or rather not knowing, not being informed. It's good to talk to them. The third question is, why is MH not funded? Why is mental health not funded? What are the hindrances, and what can be done to change this narrative in both counties and national government? The question is, why is MH not funded, and what are the hindrances, and what can be done to change this narrative in both counties and national government? Youth Alive Kenya responded by saying, lack of policies around mental health and limited investments by mental health by the national government. I'll read that again. Lack of policies around mental health and limited investment on mental health by the national government. The question was, why is mental health not funded? What are the hindrances, and what can be done to change this narrative in both counties? The fourth question is, most countries are busy commemorating the day, yet they don't allocate resources. Most countries are busy commemorating the day, yet they don't allocate resources. Neither do they have policies. How can we engage countries to allocate and plan for mental health implementation? Well, my thought to that is, yes, most countries right now are like, when you see by the end of today, a lot of broadcasts will be out talking about mental health, but nothing has been done. Nothing has been done to commemorate the day, you know. Nothing has been done. So our question here is, how can we engage countries to allocate and plan for mental health? How can we as youths allocate and plan for mental health? One response here is from Mickey. He tweeted and responded by saying, let's stand out, speak for us who are experiencing mental health all day, every day. Let's stand out, speak for us who are experiencing mental health all day, every day. On the fourth question, Joseph Ojuki responded by saying, mental health should be budgeted as an independent entity for our country and counties. We need to come together and advocate for this. Nothing can ever be done alone. If we want to do something, we should come together as youths, advocate as youths, stand together and say that this is what we want and this is what we need. Because doing something as a person will never bring out an impact. But we as youths, when we come together and say that this is what we want you as the government to budget something, to put something in our mental health, because we are not okay out here. Yeah. The fifth question is, suggest call for action for government to prioritize mental health financing. Suggest call for action for government to prioritize mental health financing. Suggest a call for action for government to prioritize mental health financing. Youth Alive Kenya again commented by saying, support the financing of mental health and enhancement of the Mental Health Act. I'm going to read another response from Tinder Youth Organization. They've said, joint partnership between government and private sectors, including CSOs and embassies, to jointly support community-based mental health services with focus to prevention and response. I'm going to give that a like. Yeah, so Joseph Ojuki again said, joint advocacy, bringing in different stakeholders together. We can bring other people together so that we can do this as a team. Our sixth question was, what is the role of CSOs in mental health financing and advocacy? What is the role of CSOs in mental health financing and advocacy? Afia Timiza responded by saying, by engaging the private sector, communities and individuals, CSOs can strengthen the resilience. And our last question was, how can we ensure effective support and promotion of mental health at community level? How can we ensure effective support and promotion of mental health at community level? Wanjengu Mike responded by saying, by promoting a safe space in our families and homes. By promoting a safe space in our families and homes. Michael Miki responded by saying, more of making everyone having knowledge that mental health is the new normal. Christine responded by saying, tracing mentally challenged people, raising their voices on their behalf, and ensuring they are treated with dignity. Tracing mentally challenged people, we as youths should go out, trace out the mentally challenged people, raise their voice on their behalf and ensuring they are treated with dignity. So guys, that was all that we're having today. I hope you enjoyed this video. Kindly give this video a thumbs up. Let's meet. So guys, that was all for today. I'm sorry for all the background noises that you guys are receiving. I'm sorry for the background noise. Kindly subscribe if you've not yet subscribed. Give this video a thumbs up and see you on my next. Bye.